Welcome back, students. Let us now discuss about diaphragm. Okay. So this term diaphragm, you will be coming across in different parts of your body. Okay. So one such diaphragm you have seen in your interior of your skull. Okay. You have something seen in and around your oral cavity or your digastric triangle. Okay. You will be getting in the pelvis. Yes. So what is that you get in your cranial cavity? Yes, the diaphragm cell. So diaphragm, what do you mean by diaphragm? A partition. Okay. So in the cranial cavity, the diaphragm cell. Okay. The diaphragm oris. Okay, which is formed by the mylohyoid muscle. Okay. So you have the mylohyoid muscle forming the floor of your mouth. So this is the diaphragm oris. Yes, yes or no? Then you have the pelvic diaphragm. But the most important, which separates your thoracic cavity from your abdominal cavity, is your thoraco-abdominal diaphragm. So in order to demarcate it, please remember that in order to demarcate it, always just contemporarily don't say diaphragm. So when you are explaining the diaphragm which is separating the thoracic cavity from the abdominal cavity, please mention it as thoraco-abdominal. Okay, thoraco-abdominal diaphragm. Okay, since you are having other types of diaphragms also. Okay, so you have a diaphragm oris or the oral diaphragm, then you have the pelvic diaphragm in your pelvis. So please mention this as thoraco-abdominal diaphragm. So what is this thoraco-abdominal diaphragm? It is a musculoponeurotic sheath, musculoponeurotic partition which separates the thoracic cavity from the abdominal cavity. So let us see from where it is taking its origin, what are its function, and I hope you all know that diaphragm as a whole muscle, with its contraction, it helps in inspiration. Okay, so one of the principal muscle for your breathing is diaphragm. So you need to understand it. What is the structure of it? What is the origin of its muscular part? What are important openings in it? What is its nerve supply? So let's first see what is the origin. Okay, so the origin of the diaphragm can be divided into three. Okay. So it takes its origin from sternum. So you can say sternal origin. Okay, first origin is from the sternum. Then you can say it takes its origin from the ribs. So costal origin. Okay, it takes costal origin. Then it takes its origin also from the vertebrae. So you can also call this origin as vertebral origin. So there are three origins for the muscular part. Okay, three origins for the muscular part of the diaphragm. So what are they? Sternal, costal and vertebral. Okay. So let us now see individually how these are taking place. Okay. So just imagine you are seeing from the abdominal side, you are seeing the diaphragm from below above. Okay. So if this is the sternum, okay, this is the sternum. I am taking a section, lifting it. So this is the sternum here. Okay. So let's imagine that these are the ribs. Okay, on either side, these are the ribs, lower 6 ribs, let us take them the lower 6 ribs. Okay, then on either side, you have something called as crus of the diaphragm, okay, or the crura of the diaphragm, crus or crura of the diaphragm. So I'll just extend this, okay, up till here. Okay. Okay, so we'll just add 2 parts here. Okay, 2 parts here. I'll just explain to you what are these 2 parts. Okay, so we'll just take this as the sternum. Okay, this is the sternum. So from the sternum, you have 2 slips. Okay, I'll draw it in different colors, please. So 2 slips arise from the sternum. 2 slips, muscular strips of the diaphragm arise from the sternum. In a similar way, you have muscular fibers, okay, okay, arising from the ribs so this will be the costal, okay, this whole of this thing will be the costal origin, okay. So this is the costal origin of the diaphragm. So the muscular part of the diaphragm arising from the lower 6 costal ribs, okay, lower 6 costal ribs, okay. So this is how you have the muscular part, which is, you can see that it is radiating to the center, okay, this is radiating to the center. So in the center, okay, in the center, there is a trifoliate, okay, there is a trifoliate type of tendon or aponeurosis of the diaphragm, okay. So this is an aponeurosis of the diaphragm with a central opening here, mostly towards the right. So just imagine this to be the right and this to be the left, so more towards. So why I have said tri? So there is a median portion to it, there is a right and left portion to it. More towards the right side, there is an opening here. So all these fibers, okay, all these fibers which are arising from the sternum, yes, and which are arising, okay, which are arising from the costal or the, yes, which are arising from the ribs, come and get themselves inserted into this trifoliate tendon. This tendon is referred to as central tendon of diaphragm, okay. So this is referred to as, I'll just mention it here, this is the central tendon of diaphragm. Okay, so you understood the sternal origin of the diaphragm, you understood the costal, okay. So lower six ribs, okay. Now coming to the vertebral, when we are coming to the vertebral, okay, so you have the, yes, at the level, so the diaphragm usually separates the thoracic cavity from the abdominal cavity, almost extending, okay, like a dome, okay, almost extending like a dome. So when you see the external appearance, okay, see the external appearance, it has two domes, diaphragm has two domes, the right and the left dome, and the central part is the central tendon part. The right dome is higher above. So you need to understand why do you have the right dome higher above? Yes, there is this large liver located here, that is why the right dome is higher up to the left. Usually these domes are referred to as cupulae or cupulae, okay. So you can pronounce it anyway. So they are also referred to as cupulae. The right cupulae is higher up due to location of the liver. The left has, yes, just beneath it you have the fundic gas shadow, yes or no. So the left dome, just beneath the left dome you have the stomach, and in the x-rays you can see the fundic gas shadow, okay. Coming to the vertebral origin, okay, vertebral origin is by two crura. I have already said that it is by two crura, especially at the level of T12, okay. There is a right crus, okay, this is the right crus or crura, and there is the left crus or crura. This right crus and left crus are connected by a median ligament here. You can see they are connected by a median ligament here. In a similar way, on the inner side, okay, on the inner side, there is a medial arcuate ligament which I have drawn like an arc here, and a lateral arcuate ligament, okay. Medial arcuate ligament, okay, this is the medial arcuate ligament on the medial side. So this is medial arc-like, so arcuate ligament. This medial arcuate ligament, please remember, is nothing but an upper thickening. It is nothing but the upper thickening of the psoas fascia. Okay, so it is the upper thickening of the psoas fascia, whereas the lateral arcuate, so this is the lateral, okay, the lateral arcuate is the upper thickening, of the thoracolumbar fascia. Yes, which layer? The anterior layer of thoracolumbar. In the previous session we have seen that there are three layers of thoracolumbar fascia, the anterior, middle and the posterior, okay. Anterior and the middle will become covering a muscle called quadratus lumborum, whereas the posterior one and the middle will be covering the erector spinae, okay. So just go through the session, it will be clear for you, okay. So the upper ends of the psoas fascia and the upper end of the anterior layer of thoracolumbar fascia thickens to form what? On the medial side, medial arcuate ligament, and on the lateral side, lateral arcuate ligament. Fibers also arise, okay, from these arcuate ligaments, okay, from these arcuate ligaments and reach the central tendon. So ultimately all these fibers which are arising, okay, which are arising from the costal sternum and vertebrae, all of them reach the central tendon and get inserted into it. Developmentally also, please remember that central tendon develops from the septum transversum, okay, develops from septum transversum, whereas the muscle fibers, okay, these muscle fibers, they all the muscle fibers arise from the myotums, okay, which migrate, okay, along with the phrenicum, which migrate, okay, these are the cervical. Please remember, these are the cervical myotomes which migrate into the pleuroperitoneal membrane. Okay, so the central tendon formed by septum transversum, whereas the remaining part into which this cervical myotomes is formed from pleuroperitoneal membrane. So developmentally, two structures help in the formation of diaphragm. What are they? One is septum transversum. You please appreciate at this point only, where and ever it is necessary, please also appreciate the embryological point of view also. So septum transversum, which gives rise to the central tendon, and in a similar way, next is pleuroperitoneal membrane, peritoneal membrane. Okay, this pleuroperitoneal membrane, okay, the remaining muscular part is formed into this pleuroperitoneal membrane by the migration of what I have said, the cervical myotomes. Please remember, it is due to migration of the cervical myotomes. Okay, along with this cervical myotomes, since these are cervical myotomes, the C3, C4, okay, the C3, C4 nerves are also brought along with them. Okay, so cervical myotomes at the level of C3, C4, nerves are also pulled along with this cervical myotome, and this nerve in turn forms what? Future phrenic nerve. Okay, please understand clearly here. Okay, since they were in the neck and they are brought to the thorax, that is why your phrenic nerves also have a long course. They reach from where do they come from? They come from the neck region, then extend into your thorax, and then supply the undersurface of the diaphragm. Okay, so this is how you have your origin of your. Coming to the vertebral region, okay, because of this vertebral region, we all had to also understand the embryology. I said there is a right crus and the left crus. The right crus arises from the upper, okay, arises from the upper three lumbar vertebrae, okay. Till now we have dealt everything related to ribs. It was at the thoracic level and the ribs, lower 6 ribs. Here, the crura will develop on the right side from the upper 3, whereas the left one develops from the upper 2, and in the median it is connected. Even this crurae give rise to, okay, they give rise to the muscle fibers here. So at this point, you need to understand that there are certain openings also in the diaphragm, okay. So after understanding the origin, insertion, and then understanding the development and the nerve supply with the development, please also understand that there are some openings in the diaphragm. These openings are referred to as, some are major and some are minor. So you need to concentrate more on the major opening. So what are these major openings? Okay, first and foremost, in the central tendon, I said there is an opening in the center. This opening is for the inferior vena cava. Okay, this is for the opening of what? Inferior vena cava. So in the central tendon, you have the inferior vena cava, and this inferior vena cava usually, yes, passes through this opening. Okay, so the first major opening is that of the inferior vena cava, and this is at the level of T8 and T9. Okay, T8 and T9. Next is some fibers. Okay, some fibers of the right crus, they pass obliquely. Okay, they pass obliquely towards the left. Okay, spiral around another opening. Okay, spiral around another opening. This is the opening of, okay, this is the opening of the esophagus. Okay, this is the opening around. So which fibers are taking? The vertebral fibers are taking a spiral course and encircling the esophagus. So the second major opening is the esophageal opening. Okay, so as said, esophageal opening is more towards, yes, it is more towards the left side, and this is at the level of T10. Okay, this is at the level of the T10. Most fibers of your right crus, okay, most fibers of your right crus orient there. Last but not the least, the major opening between the right crus and the left crus is for the aorta. Okay, the descending or the descending thoracic aorta becomes abdominal through this, between the two crus of the diaphragm, which is bounded above by the, yes, okay. So the aortic opening is bounded above by the median ligament on the right side by the right crus, left side by the left crus, and posteriorly by the vertebra. Okay, this aortic opening, important major opening, that is aortic opening, is at the level of T12. Okay, so please remember the order, it will be easy, 9, 10, 11, so sorry, 9, 10 and 12. Okay, so at the level of T8 and 9, you have inferior vena cava. At the level of 10, you have opening of the esophagus, and at the level of T12, you have the aortic opening. These are the major openings. Some of the minor openings, okay, to understand it, some of the minor openings you need to understand or appreciate it is at the sternal origins, okay, at the sternal origins, there are minute openings for the passage of superior epigastric arteries. Okay, minor openings for the passage of superior epigastric arteries. Okay, if you remember, the superior epigastric artery is one of the important, okay, one of the terminal branch of the internal mammary or internal thoracic artery, which has to reach the rectus sheath to anastomose with the inferior epigastric artery. So, one of it is the superior epigastric artery. Between, okay, between the costal origins, okay, between the costal origins, usually the costal origins of the muscle fibers of diaphragm interdigitate with the costal origins of the transverse abdominis. So, even your abdominal muscles also take their origin, especially the transverse abdominis takes origin from your lower 6 coastal or lower 6 ribs. Okay, so there will be interdigitation between the fibers of diaphragm and the transverse. So there are minute spaces between them. These minute spaces between them usually allow, okay, usually allow the lower 6 thoracic spinal nerves. Okay, so lower 6 thoracic spinal nerve. So next minor openings are for the lower 6 thoracic. Okay, so I am mentioning it T, thoracic spinal nerves. Spinal nerves. So these are some of the important, okay, so these are some of the important minor, okay, minor openings. Please remember the major: inferior vena cava, esophagus, esophageal opening and aortic, and the minor ones are for the superior epigastric, which is prominent in then the lower 6 spinal nerves. Now not only that, in relation to medial and lateral arcuate ligament, medial and lateral arcuate, just beneath the medial ligament, medial arcuate ligament, you have subcostal nerves and vessels arising. Okay, medial costal, you have the subcostal, okay, you have the subcostal vessels arising. So these are all minute opening. So just remember, the two most important are these, you need to understand them. Okay, so these are the major and minor openings in the diaphragm. So a small note on how diaphragm is going to help in inspiration. So please remember that principal muscle for your breathing is diaphragm. So when the diaphragm contracts, okay, when the diaphragm contracts, the inferior vena caval opening dilates, okay, dilates or it relaxes. So when it is contracting, what is it doing? It is pushing your abdominal contents down. Once it is pushing your abdominal contents down, what is happening? Your anterior, your diameter of your thorax is increasing. So there is a ease for the expansion of your lungs. Once there is ease for expansion of your lungs, what is happening? You are inhaling air. Okay. Once you are pushing the diaphragm down and helping in the expansion of your chest cavity or your thoracic cavity, lung capacity is being increased. As you are pushing the diaphragm down, what is happening? Your abdominal contents are protruding forward. Hence, how are you going to see, especially in obese persons, you can usually see that instead of chest, you can see that their abdomen moves forward and backward when they are inspiring and expiring. Okay, this is how, what is it doing? The diaphragm is pushing downwards the viscera, which in turn is protruding forward the anterior abdominal wall and increasing the space. Okay, so once the diaphragm is contracting, it is also fixing the lower costal ribs. Okay, lower costal rib, lower ribs are being fixed. After it is contracting, once the ribs have been fixed, there is an increase in the intra-abdominal pressure and there is a relaxation. Please remember, there is a relaxation of the inferior vena cava. Because of this relaxation of inferior vena caval opening, what is happening? There is increase in venous return to our heart. Simultaneously, what is happening? Because of the contraction of the diaphragm, your esophageal opening is closed. So, what is happening? The esophageal opening is closed, hence it prevents reflux from the stomach. So, hence here what is happening? The right crust is acting like a sphincter, preventing any regurgitation of food backward. So, that is why simultaneously you can't inspire, okay, you can't breathe and swallow. The similar principle we have also seen in the nasopharynx and oropharynx, if you can read. So you can't do simultaneously. Okay. Another important reason here is opening of when diaphragm contracts, there is opening of inferior vena cava leading to venous return, but there is closure of the esophageal opening preventing regurgitation of food. But there is no change or effect on the aorta. Please also remember, through the aortic opening, you also have important another structure passing through it is the thoracic duct. You also need to understand that. So through the aortic opening, you also have thoracic duct. Okay, so there are other certain minor things. Sometimes there is also azygous vein passing through it, minus there, but they are quite variable. Okay, different people have different, but please remember these are the major one, and thoracic duct is also one structure which will be accompanying. And even in around the esophagus, you also have anterior and posterior vagal trunks. Okay, so along with the esophagus, you also have anterior and posterior vagal trunks. Okay, so vagal trunks, not only this, okay, not only this, along with the thoracic duct, what else do you also expect to pass through the aortic opening? Yes, the phrenic nerves. Okay, so the phrenic nerves need to, okay, they also need to pass through the aortic opening so that they will be supplying the diaphragm. Please remember, along with the esophagus, you have anterior and posterior vagal trunk. Along with the aortic opening, you have, please remember that for the inferior vena cava, it is only inferior vena cava which is allowing it. Whereas the aortic one, you have the phrenic nerve as well as the thoracic duct passing it. So understanding the principle. So please understand how the diaphragm is helping as a, not only this, secondarily, diaphragm contraction will be helping in increasing the intra-abdominal pressure in conditions like, yes, because of its contraction, it is increasing the intra-abdominal pressure. Once the intra-abdominal pressure is being put up, so this increased intra-abdominal pressure is utilized for parturition, yes, delivery of the babies, for micturition as well as defecation. So all these activities are important. Though it is a primary muscle for the breathing, it secondarily also helps in this process.